Around this time 5 years ago, the COVID-19 pandemic was quickly starting to spread around the nation and introducing us to social distancing, masking, and ultimately claiming many lives. Now, some Republican lawmakers in South Carolina believe it's time to implement guarantees in future emergencies to better protect individual liberties, as they describe it. But as State House reporter Mary Green explains, others worry the consequences could be dangerous.
Supporters of a bill called the Medical Informed Consent Act say it's designed to prevent government overreach during emergencies. But some fear if it's implemented, it could wind up causing more harm than good.
South Carolinians want the state to have the power to properly respond to an emergency. However, they don't want emergency powers to be potentially weaponized against them.
Among its provisions, the bill would prohibit employers in South Carolina, including private companies, from requiring workers receive any type of vaccination as a condition of employment.
Nobody, and I've said this many times, should have to choose between a jab and their job.
The bill's lead sponsor, Republican Senator Shane Martin, says this is geared toward the COVID vaccine and other type of novel vaccines, as he described them. Martin also claimed it would not change existing vaccination requirements for K-12 students to attend school. But pediatricians say they read it differently and believe this would infringe on those school shot mandates for diseases like polio, measles, and chickenpox. So they asked Martin to make that more clear.
I don't understand why we would want to prevent future vaccines from being developed or used and mandated. Please remember that the majority of the diseases we vaccinate for don't have any medical cure, and therefore prevention is key.
Pharmacists also took exception with part of the bill that would limit their ability to refuse to fill prescriptions except under very narrow circumstances.
I would equate this to turning pharmacy into a vending machine. You put in your insurance card, and just because you got a prescription, it spits it out. There's no protection of the patient.
Another part of the bill would scale back the state and the Department of Public Health's powers during emergencies, including removing the public health director's authority to require law enforcement help carry out their orders.
It doesn't mandate that the sheriffs get involved.
Last year, in a similar bill, a proposal to reduce the state's emergency response powers drew opposition from South Carolina's health and emergency management leaders and Governor Henry McMaster. A spokesman for McMaster says the governor still does not believe this legislation is necessary. There's another hearing for this bill scheduled for this Wednesday, when amendments are expected to be proposed, but no additional public testimony will be taken. Reporting from the State House, I'm Mary Green.
And right now, this bill still sits in a Senate Medical Affairs Subcommittee, and it's several steps away from reaching Governor Henry McMaster's desk at this point.
What happened?